Now, how can the HSA really benefit you? Right? How can the HSA, other than the free qualified medical expenses that you're going to have, and they're not free, right? You're saving for them, and then you can spend that money on them. How can the HSA help you as you age? Right? Well, obviously, as your costs get higher for your medical expenses, then you can use the HSA to continuously pay for them. But let's say you never really had high healthcare costs, and you get to retirement and you've been relatively healthy, you've been very blessed, and you get to this point in retirement and you're like, well, I got all this money in an HSA, it's grown tax-free, I've had it invested well, I have a substantial amount of money in an HSA. What can it help me do? Why is it useful at this point? Well, let's go down the list. First, it can help you bridge to Medicare. Okay, so if you retired prior to age 65, you may still need health care coverage to help you bridge the gap to Medicare eligibility at age 65. Generally, HSAs cannot be used to pay for private health insurance premiums, but there are two exceptions: paying for health care coverage purchased through an employer-sponsored plan under COBRA and paying premiums while receiving unemployment compensation. And this is true at any age, but may be helpful if you lose your job or decide to start working before age 65. So it can help you bridge the gap until you get to Medicare, and that is extremely useful. Now, when you get to age 65, you can no longer put money in to an HSA, right? You get to age 65, you get to Medicare, no more putting money in to an HSA. But the money that you have in the HSA obviously can keep growing for you, and it can cover your Medicare premium. So you can use the HSA to pay certain Medicare expenses, including premiums for Part B. So a lot of people don't know Medicare has several parts. Part A is going to cover your hospital bills, 80%. Part B is going to cover your other, doctor's expenses and medical expenses, and you have to pay for Part B based on what your income is. And those Part B expenses, those Part B premiums, can be paid by your HSA. And then also your Part D prescription drug coverage can also be paid for with your HSA, but not supplemental Medigap policy premiums. You cannot pay for those. But for retirees over age 65 who have employer-sponsored health coverage, an HSA can be used to pay for your share of those costs as well. So if you're over the age of 65 and you have employer-sponsored health coverage and you're paying for premiums for that, then the HSA can be used in that way as well. So those are two good benefits already, right? Help bridge to Medicare, cover Medicare premiums, but it gets even better. And why does it get better? Because it can also be used to cover part of the cost for a tax-qualified long-term care insurance policy. And this is big, right? And those of you who are young may not be thinking about it, but those of you who are getting closer and closer to retirement might want to think about this. And I've talked about it a tad bit before, and that is the idea of long-term care insurance. And long-term care insurance is just going to be something that you pay for in order to cover your long-term care facility needs if and when you need them as you age. And if you end up needing a long-term care facility, you can pay for those, right? At least part of those costs out of your HSA. And you can do this at any age, but the amount that you can use increases as you get older. And again, that is extremely beneficial because long-term care insurance policies are expensive. Long-term care insurance policies have higher premiums, and so you should be taking advantage of this. If you have an HSA and you can use it for this reason, then you should absolutely be doing so. Now, all of these very, very good things, very, very good advantages that individuals can have if they have HSAs. But let's talk about this fourth one, right? And this fourth advantage in retirement to an HSA is a huge one, and it is a big reason why you want this money invested. And it is you can use the HSA to pay for other expenses. So once you hit age 65, you can use the HSA, any money you have in an HSA. Again, you cannot put money in after you're on Medicare at age 65, but you can use your HSA to pay for any non-qualified medical expenses, including buying a boat, for example, right? So that's non-qualified, right? So really any expenses at all, you can use this money, right? But you will not get to take full advantage of the tax savings as you will be required to pay state and federal taxes on the distribution. So basically what this turns into, right? If you hold an HSA to age 65, it turns into a traditional IRA Now, how does that work? Why is it like that, right? Obviously, you can still be paying for qualified medical expenses out of it and getting those tax advantages, but any money that you use to pay for whatever you want and spend on whatever you want is treated like a traditional IRA. And here's why. Because if you'll remember, when you put money in, it was pre-tax, right? When you put money in to this HSA, you got the tax deduction, same way you do with a traditional IRA or any other traditional type of retirement account. The money grew, and it grew tax-free. Now, in the similar way, a traditional IRA is going to grow tax-deferred, but tax-free growth turns into tax-deferred growth if you have to pay taxes later on, right? Well, this is going to make you pay taxes on that money when you take it out. It can become income to you, but you can use it for absolutely anything and you are not penalized. And that is so huge because otherwise you would be penalized for taking that money out and using it for anything else, but there's no penalty and you can pay for any other type of expense if you are 65 years of age or older. Huge benefit, right? Huge benefit. So not only can we get a triple tax advantage if we use it for qualified medical expenses, not only can that happen, but we can end up using it for bridging to Medicare, covering Medicare premiums, covering the cost of long-term care insurance policies, and paying for whatever we want if we are willing to pay the taxes on it, if we are willing to pay the taxes on that money that we took out of the account. And you can see this HSA idea looks better and better by the day, and it is especially helpful, and we're going to talk a little bit more about contributions here in a moment, and it is especially helpful if your employer, and a lot of employers decide to do this, they decide to put money into the HSA for you, put a certain amount in for you. And it is not necessarily a matching contribution like a 401k would be, although some can set it up that way. A lot of employers just offer to put in a certain amount for you. So if nothing else, they can put money into an HSA for you over time. And if you don't use it, you can have this money to use as you age. You can have this money to use for really big and important expenses for you towards retirement. Because some of the biggest expenses for individuals as they age have to do with healthcare, has to do with Medicare, has to do with long-term care, right? Has to do with all these different types of things that are surrounding healthcare. And if you have built up substantial assets in an HSA, then you can really benefit from having those assets laying around because you don't have to worry about coming up with the extra income to pay those expenses that you need to pay or pay those premiums or whatever it may be that you need to pay. You already have that money laying around. You don't have to worry about it. You can just pay it out of your HSA and not worry about it at all, and it will not be taxable to you unless you decide to use that money for whatever the heck you want to use it for after age 65.